Hello everyone, I have a question for you. Do you know what is Rickets disease? No? Well, let's find out together.
So what is defined as Rickets disease? Rickets is a condition that affects bone development of child due to deficiency of impaired metabolism of vitamin D, phosphorus or calcium, potentially will lead to deformities and fractures. It is found that children and pregnant women are found to be vulnerable to have rickets or osteomalacia due to deficiency of vitamin D. Did you know that children that have less exposure to the sunlight and have very dark skin may at risk to have a low vitamin D? Hence, it is important to have sufficient vitamin D, which helps to absorb calcium and phosphates from resources such as food, which is important for development of bone. There are different types of Rickets disease that classified into different groups, which contribute from the cause of the condition. The first types of Rickets disease is nutritional rickets, which consists of vitamin D deficiency caused by inadequate sunlight exposure, solely breastfeed or dark skin, phosphorus deficiency that caused by diet deficient in phosphorus or malabsorption syndromes, and calcium deficiency that caused by diet deficient in calcium and malabsorption syndromes. Another types of Rickets disease are vitamin D dependent rickets, which consists of type 1 and type 2, vitamin D resistant rickets, which consists of X-linked hypophosphatemic rickets and hereditary hypophosphatemic rickets. And the last types of Rickets disease are miscellaneous, which consists of renal rickets caused by chronic renal failure, oncogenic rickets, which is caused by tumor-induced inhibition of renal, and rickets of prematurity caused by multifactorial.
Moving on to incidence and prevalence, Rickets disease is estimated to affect most of the world population, especially in regions with low sunlight resources. It is also proven to be common in children rather than adults. According to World Health Organization or WHO, the peak incidence of rickets occurs among infants and young children aged 6 to 23 months and adolescents aged 12 to 15 years. Did you know that in Malaysia, Rickets disease is a rare type of disease? This is because Malaysia is a tropical country with sufficient sunlight resources, which is one of the main resources of vitamin D in individuals. However, recent study towards 13-year-old adolescents has proven that the prevalence of vitamin D insufficiency is significant even in tropical countries such as Malaysia. The lack of exposure to the sun could be due to lack of involvement in outdoor activities or due to living a sedentary lifestyle such as lying down or watching television.
Clinical feature of condition. Rickets disease also been associated with the bone pain or tenderness in arm, leg, spine and pelvis. Besides that, it is also associated with impaired growth and also a short stature. Rickets disease also been associated with a skeletal deformity. The first one is a spine deformity such as a curved spine. Second is a pigeon chest or known as a pectus carinator. Is a malformation of the chest that been characterized by a protrusion of the sternum and rib. The third one is a frontal bossing. That is a term that been used to describe a prominent and also protruding forehead. The fourth one is a pelvic deformity. Besides that, Rickets disease also been associated with a teeth deformity. Rickets disease also been associated with a muscle cramp because in a study shown that a hypophosphatemic ricket will alter the transmembrane potential of muscle cells and change the composition of the skeletal muscle that will result in a decreased muscle tone and also strength, and also will give a high tendency to get a bone fracture.
Next is the map of health condition according to ICF. People with Rickets disease will have problem in body function and structures including pain and discomfort, limited range of motion and abnormal gait pattern, muscle weakness and balance and stability. They will have limitation in activities such as mobility, fine and gross motor, self-care and domestic life. The limitation will give restriction to their participation in education, sports, leisure, play and community and social life, and the environmental factors and personal factors are also in relation to cause limitation for people with Rickets disease.
Next, for the frame of references, there are two frame of references that can be used for this condition, which are biomechanical frame of reference and rehabilitation frame of reference. The biomechanical frame of reference is considered as a remedial approach focusing on impairments that limit occupational performance. It focuses on musculoskeletal capacity to create movement, strength, and endurance in order to carry out meaningful occupations. This frame of reference also assumes that engaging in occupation and therapeutic activities has the potential to remediate the underlying impairment and results in improvement in occupational performance. The deficits addressed by BFOR includes structural stability, high and low level endurance, edema, maintaining and increasing range of motion, and also maintaining and increasing strength.
Next is the rehabilitative frame of reference that focus on returning the ability of people to engage in daily activities to the fullest according to their capabilities. It is commonly used in remediating permanent injury that are unlikely to have full recovery by compensatory method to the occupation or environment. This frame of reference found suitable to be used for Rickets disease to prevent other complication or injury to occur due to fall by providing education on fall prevention, home modification by using aids and assistive devices to reduce risk of fall, and techniques to compensate restricted activities for better engagement in daily life.
The first intervention is strengthening exercise, which is ascending and descending ramp. For the procedure, first we need to explain and demonstrate to the client how to perform the activity. Then, remind the client to alert therapist or any available individual if felt any pain or fatigue. Next, instruct the client to slowly walk up the ramp as demonstrated earlier. After succeeding in going up the ramp, take 10 seconds break before asking the client to proceed walking down the ramp. Repeat this activity for a few rounds. The frame of reference used for this intervention is biomechanical frame of reference because we are focusing on remediating underlying impairment. For the grading, gradually aid weighted cuff around the ankle to increase intensity. For the evidence, according to Mosty et al., muscle strengthening exercises and resistance training are important for building and maintaining bone density. This is because rickets cause increase in bone area. Therefore, the individual will help reduce bone mineral density. Thus, it is proven that by incorporating strengthening exercise towards clients with Rickets disease will help improve their bone mineral density.
Next intervention is a physical action modality. This intervention is a preparatory method that supports and promotes the acquisition of the performance skills that are necessary to enable an individual to resume of the assumed habit. The procedure of this intervention is by using a direct coupling. Direct coupling is a transfer of electrical energy by means of a physical contact by using a conductive medium. The direct coupling can be done by using a gel or a cream that been applied on top of the body of the patient. Next, we must use the approved coupling agent, and we must remove the air bubble by passing the sound head over the area before the power is increased. Move the sound head slowly with a 4 cm per second and must maintain firm and constant pressure. Moving the head faster will decrease the heating. If the body part is hairy or have an irregular shape, the effectiveness of this method may be reduced. If the patient state that they feel discomfort, the therapist must decrease the output intensity. This therapy session will last no longer than 5 minutes. The frame of reference that being used for this treatment is a biomechanical frame of reference. There is no strong evidence that states that this intervention needs a grading. According to Nori, in 2020, state that the ultrasound will provide a significant improvement in a pain intensity that may be potentially helpful for a short-term pain relief.
The last intervention is home modification and prevention of fall. The evaluation and assessment will be done before the intervention for home modification. Recommendation for adaptation of modification will be given based on the needs of patient during evaluation and home visit. The modification that can be done includes providing access in the house, by modifying the arrangement of furniture, especially for patients that will use assistive devices. The toilet and shower also is recommended to be remodeled for easy access for patients that have wheelchair. Modification can also be done with adaptation in each area such as kitchen, bedroom and closet. Some of patients with Rickets disease need to use wheelchair or walking aids, hence it is important to have modification for the safety and avoiding any injury or falls, which will later cause other effects on patient. The modification includes avoid uneven floor, managing cable and wires especially on frequent access of patient in the house, place non-slip mat in the bathroom, and install grab bars and handrails at access area that may have possible hazards such as toilets, living room and kitchen. The frame of reference that's suitable to be used is Rehabilitative frame of reference, since the intervention is focusing on providing compensation for patients with Rickets disease. The example of modification that can be done is, in the kitchen is lower counter height with spaces for wheelchair user, installation of grab bars in the toilet to avoid fall, and managing the cable and wires using the case to avoid hazard. Based on Rush et al. 2019 stated that a total of 50.8% child with hypophosphatasia reported using assistive devices or braces for mobility at some time. 17.1% of them need to have home modifications consequence of their conditions.
In a conclusion, the Rickets disease had been associated with vitamin D deficiency. Although the country have an adequate sun exposure, there is a risk to have a Rickets disease. Thus, a non-pharmacological treatment is needed to avoid the deformity of the bone. The occupational therapy treatment goal for the patient that have a Rickets disease are to relieve the symptom and to prevent further deformity.